Medicine of the Revolutionary War. Soldiers are often credited for the success of the Revolutionary War for fighting for independence from Great Britain, but in actuality there were thousands of heroes that deserve our thanks: the doctors, surgeons, and nurses who saved the lives of wounded soldiers. Each regiment of the Continental Army was assigned a surgeon and multiple surgeon assistants to travel beside them. By the start of the Revolutionary War, there were approximately 3,500 practicing physicians. This is a list of a few certified doctors who practiced during the war. There were two ways of becoming a certified doctor in colonial America. A person could attend medical school or complete an apprenticeship. There were only two medical schools located within the 13 colonies: King's College of New York, pictured here, which is currently Columbia University, and the Teaching Hospital of Philadelphia, now the University of Pennsylvania. Medical school was very expensive and prestigious, encouraging many people to participate in an apprenticeship, a 7-year-long program in which students observe an actively working doctor. This is an image of the Teaching Hospital of Philadelphia. In a school like this, medical students would spend their hours reading the books of ancient philosophers such as Hippocrates and Galen. There were no clinical studies, meaning a doctor did not have patient contact until they had the scalpel in hand. However, if you were in an advanced medical school in Europe, you may have taken an anatomy lesson. In order to graduate from medical school, you would need to present a philosophical thesis in front of a board of doctors in Latin. Students were taught that most wounds on the battlefield were caused by an imbalance of the humors. As you can see, medical school, as well as the practice of medicine in the late 1700s, was based on theories and not reason or logic. A soldier in need of treatment would be escorted to various locations depending on the severity of his injuries. Most procedures took place at nearby houses or hospitals. Because the operations took place in such odd places, we know that sanitation was not a priority during the Revolutionary War. If an injury was more severe, the patient would be moved to a larger public space such as a barn, church, or a schoolhouse like the one pictured here. Doctors and surgeons during the Revolutionary War did not have the incredible equipment that we have available today. I took this photo, as well as the next one, at the Smithsonian Museum of American History when I visited in early November of this year. This image pictures a bloodletting set that was used to drain patients of a few ounces of their blood in hopes to remove their sickness. There are also tools for grinding medicines and vials for storing medicine. Disease struck many soldiers, even if they survived combat. The most frequent diseases were mumps, measles, and smallpox. Doctors during the Revolutionary War were responsible for saving as many patients as possible. This shows the amputation tools surgeons used for wounded soldiers. During battle, iron cannonballs would settle inside of limbs and bones, and vital organs were punctured. The pictured tools would peel away the skin in search of bullets. If the surgeon decided their efforts would not save the limb, they would begin their amputation. Disease and combat wounds filled hospital beds rapidly. Because of this, there were dozens of people surrounding the ill at one time. This gave diseases a place to flourish and spread. Interestingly enough, doctors began to inadvertently vaccinate the vulnerable from certain diseases. For example, doctors would take pus from a person infected with smallpox and distribute a small amount to healthy people. This would give a healthy person time to build antibodies to fight the disease before they were actually faced with it. Other and more crucial procedures were executed quickly to save blood and give more patients a chance to see a surgeon. Amputations were the most common procedure during the Revolutionary War. Doctors would amputate limbs if a bullet had made contact with a bone. Otherwise, skin was removed and the limb was probed with a hand to find the bullet. Bloodletting was another common operation. A doctor would pierce the skin behind the ear, in the elbow, or behind the knee and drain a few ounces of blood. They believed this would get rid of the patient's bad blood. Once they were finished draining, they then dumped the blood onto the floor a few feet away from the hospital bed. Yet another example of unsanitary conditions. Unfortunately, doctors did not know of infection whatsoever. In fact, they considered it as a part of the healing process. Many of their diagnoses were based off of theory, which is why many ill people were said to have been breathing bad air, especially if they lived near a river. There was extremely poor hygiene and sanitation in hospitals, but doctors tried to keep clean by rinsing tools every so often. All in all, doctors attempted to save as many lives as possible and prevent the spread of disease as best as they could with the knowledge that they had.